Good morning. This is a report on David Montanari. David presented to the emergency department 4 days ago after a motorcycle accident. He's a 19-year-old male, a patient of Brian Craig. He suffered a T4-T5 burst fracture with spinal fusion and a right scapula fracture. He sustained the T4-T5 burst fracture, which was stabilized in the OR on the day of admission. He has no other pertinent medical history. He works full-time at a retail store as a cashier. He's also attending college classes part-time, and his family is supportive. He has no known allergies. He has a full code. Last vital signs were a temperature of 99.0, blood pressure 94 over 68, pulse 62, respirations 20, and he's satting 97% on room air. His most recent pain rating was a 3 out of 10 in his back, but he's not requesting any medication right now. He had hydromorphone 0.5 milligrams every 3 hours as needed. That's what he has ordered for pain. He has an 18 gauge right ACIV D5 half normal saline at 75 milliliters per hour. His surgical dressing is clean, dry, and intact, and the sutures are intact. He has a regular diet. He is on bed rest, a high fall risk, and standard isolation precautions. He is alert and oriented. He has no sensation or motor function below the nipple line. There is no change in his sensation or motor function since admission. He has a regular heart rate and rhythm. Lungs are clear bilaterally, and he's been using the incentive spirometer. He is tolerating the regular diet and drinking lots of fluids. His last bowel movement was yesterday. The Foley catheter was removed yesterday evening for bladder retraining. There is an order to straight cath every 4 hours for bladder retraining, and the last catheterization was 4 hours ago for an output of 600 milliliters. He has an abrasion to the left hip from the injury. It's healing with no signs or symptoms of infection. Occupational therapy has been working with David on mobility. He seems slightly anxious about his condition. His family is supportive, but when he's alone, he gets really down. He said he was exhausted last night, but hopefully he will feel better after a long night's sleep. Morning labs were normal. He is stable, but dealing with multiple issues, including coping with the injury and limitations. Plan of care is to provide emotional support, straight cath every 4 hours as part of the bladder retraining. There are no other pending tests or results. The case manager and social worker will continue to discuss discharge plans with the family and patient.